Scabies is a very common skin problem. It is an infestation, which means it is caused by a tiny creature that lives on the skin. This creature is a mite called Sarcoptes scabiei. Scabies spreads easily from person to person. This makes it common in places where people are in close contact, like schools and care homes. Anyone can get scabies regardless of age, race or hygiene. Even clean people in clean environments can get it. Scabies is particularly common in young children and those who live in crowded conditions. It's important to remember that getting scabies is not a sign of being unclean. The female scabies mite is the real troublemaker. She burrows into the upper layer of the skin and lays her eggs. These eggs hatch and the baby mites mature and repeat the cycle. This burrowing and the waste products from the mites are what cause the intense itching associated with scabies. A doctor can usually diagnose scabies by looking at the rash. Sometimes they might take a small scraping of the skin to look for mites, eggs, or fecal matter under a microscope. This helps confirm the diagnosis. It is important to note that scabies is not always sexually transmitted, but can be spread through any skin-to-skin contact. The hallmark symptom of scabies is intense itching. This itching is usually worse at night and can be so severe that it disrupts sleep. The itch is often the first sign of scabies, and it can start anywhere from 2 to 6 weeks after contact with an infected person. Along with the itching, a red, bumpy rash appears. This rash often looks like small pimples or blisters. It can show up anywhere on the body, but is most common in warm, moist areas like the finger webs, wrists, elbows, armpits, waistline, buttocks, and genitals. Scratching the itchy rash can lead to sores and breaks in the skin. This is called excoriation. These open sores are at risk of becoming infected with bacteria, leading to a secondary skin infection. This is why it's crucial to see a doctor if you suspect scabies. The intense itching is not caused by the burrowing itself. Instead, it's an allergic reaction. Our bodies become sensitized to the mites, their eggs, and their waste products. This allergic reaction triggers the intense itching and inflammation in the skin. Thankfully, scabies is treatable. Treatment usually involves a prescription cream or lotion that kills the mites. Permethrin cream is a common and effective treatment option. It's applied to the entire body from the neck down and left on for 8 to 14 hours, usually overnight. Another treatment option is a lotion containing ivermectin. This is taken by mouth, usually as a single dose, and sometimes a second dose is needed a week or 2 later. Ivermectin is often used for people who have widespread scabies, crusted scabies, or who haven't responded well to topical treatments. It's crucial to treat everyone in the household simultaneously, even if they don't have symptoms. This helps prevent the spread and reinfestation. Along with the medication, it's essential to wash all bedding, clothing, and towels used by the infected person in hot water and dry them on high heat. While the medication kills the mites, the itching may take several weeks to completely disappear. This is because the allergic reaction in the skin takes time to subside. Your doctor may recommend over-the-counter antihistamines or topical corticosteroids to help relieve the itching while the skin heals. Preventing the spread of scabies is crucial. Since it's primarily spread through direct skin-to-skin contact, avoiding close contact with an infected person is the most effective way to prevent getting it. This includes avoiding sharing beds, clothing, towels, or other personal items. While less common, scabies can sometimes spread through contact with infested objects like clothing, bedding, or furniture. However, the risk of getting scabies this way is much lower than through direct skin-to-skin contact. Washing potentially contaminated items in hot water and drying them on high heat is essential if you suspect exposure to scabies. If you or someone you know has scabies, it's important to inform close contacts so they can get checked and treated if necessary. Early detection and treatment are key to preventing the spread of this highly contagious skin condition. Remember, scabies is treatable and preventable, and with proper care you can get rid of it and stay itch-free.